Hi, I'm Jack Hunt, and this is for Professor Mark Hill's class, and this is my oral presentation. And the subject that I chose is the legalization of assisted suicide. Um, so I started college about 2 years ago, and I've had to write a few different papers in the past, and I've chosen on, I think, two occasions, assisted suicide. So I've done a lot of research on the Right to Die movement, which is a pro-choice movement in favor of legalizing euthanasia in the United States. But this is euthanasia in the case of a person who has a deteriorating illness, and in the case that their doctor approved that it was okay, and when the patient knows what they're doing and has a complete sound mind and makes that decision along with their family that they would rather just end their suffering than continue to be put through pain and everything. Right now, it's illegal in the United States, clearly, and this was really big back with Dr. Kevorkian helped administer euthanasia to, I think, over 100 patients illegally. And the way it's set up right now, there's a famous place in Switzerland that a lot of people from the United States sometimes have to travel all the way to in order to be put out of their misery with dignity. But what I guess I'm calling for and the Right to Die movement is calling for is the legalization of maybe a few institutions in the United States so that people wouldn't have to travel halfway across the world just to die peacefully when they're in this situation. And basically, the proposed solution is really simple. It's really simple when you think about it, but I guess it gets more complicated since it's dealing with sanctity of life and there's a lot of pro-life opposition to it. But the solution would be simply to legalize the euthanizing of someone who is in a deteriorating condition but of sound mind, and if they come to a consensus with if they have any close family members that it's for the best and they want it done, then they can have access to that with the approval of their unbiased approval of their doctor. And that is basically what I would be proposing should be done. And that's it. So that's my oral presentation.